T's a cheerleader. She's been thrown up 3 metres in the air. She's landed on her head.
You in any pain anywhere at the moment?
Pressure on my head.
Pressure in T's head does ring alarm bells.
We'll roll you onto your side so you can feel down your back. Let us know if the bony bits are sore.
Oh, yeah.
With that amount of pain in her head and neck, I'm worried there's something we haven't discovered yet.
The pressure on my head's getting worse. Constant pressure. It was a 7. It's an 8 now. Oh.
You were by my side, came to my aid. Look inside my eyes and help me try to ease the pain. You're my lifeline. Tell me it's gonna be right. You're my lifeline. Reach out your hand, take mine.
Very worried for you, my friend.
The bone's been smashed to bits. He's actually stopped breathing.
Help me, please save me right now.
Without intervention, he's likely to die.
That's better.
I need you to save me now.
At the Royal Melbourne Hospital, Emergency Registrar Dr. Beck Hughes loves being able to bring her 4-year-old Groodle Trevor to work as part of a de-stress program.
Trevor is an absolute little superstar. Hello. Have you met Trev? He loves nothing more than being the centre of attention. Roll over. Sit, drop, roll over. Such a simple thing of just bringing an animal into a staff room when you might have been dealing with a really stressful situation, just to be able to come and have a pat helps you settle back down. He's just so joyful. He's always got a smile on his face. Come on, thanks. Just make you feel happy.
While Trevor stays behind to get lots of pats, Dr. Beck's needed in ED, with her next patient arriving.
Royal Melbourne receiving.
Today, Dr. Beck is working alongside emergency Dr. Farhad Yusuf, known as Dr. Faz.
Coming to you with a trauma call, 79-year-old male, up a ladder, estimated height of about 1.5 metres. We're working on the theory of a chest injury, initial room air stats of 87%.
We'll take it.
They're bringing in a man who's fallen backwards off a ladder onto a fire hydrant, complaining of a lot of pain in his back. When we hear low saturations of 87%, we're thinking that there's a problem with the air getting in.
No, please.
Has he done something to his lungs when he's fallen? That's a significant mechanism of injury. He really could have done some damage.
He's just arrived.
Dr. Beck and Dr. Faz immediately divide up the roles.
So one of us should probably team lead.
I know you're an amazing ultrasonographer.
Wow.
Do you want to jump on either?
Yeah, sure, that'd be good.
Maybe I can team lead?
Yeah, 100%. So it's a trauma alert. Sounds like we're most worried about left chest injury.
Met Pack is here. Oh, here we go. G'day, my name's Beck. I'm one of the doctors.
Anthony, a retired plasterer, was up a ladder pruning his lemon tree when he lost balance and fell.
Pop your hands over your chest.
That's the way. 2, 3.
We see a lot of ladder injuries, particularly men.
Keep your mouth shut.
Older guys climbing up ladders is a significant risk. Got a little bit of work of breathing, doesn't he?
Hi, Anthony. I'm Faz. I'm one of the doctors.
With Anthony struggling to breathe, Dr. Faz immediately searches for any internal bleeding or injury to his lungs.
Lots of doctors and nurses looking after you here. Just going to do an ultrasound.
We're looking to see if that lung has collapsed or if there's blood filling up in the lungs. Both can make patients have low oxygen very quickly and need to be fixed urgently.
Have you got any family coming in?
Anthony's wife, Gail, was at home when she realised something terrible had happened.
We heard an almighty crash, so we raced down there, and he was between the lemon tree and the wall of the work shed. It was terrifying because I'm thinking the worst. I thought he was going to die.
While Dr. Faz continues scanning for internal injuries, Trauma doctor Sue Lee quickly checks to see how well Anthony's breathing.
Another deep breath. One more. Whereabouts do you have the pain? Over there? Okay. Yeah, all right. Yeah, okay, on your back as well.
Anthony's in a lot of pain over that left chest wall.
Yeah, maybe I'm a little bit more pensional.
There could be a punctured lung.
Relax, right? Sit still.
He could also be bleeding into his lung.
I'm gonna have a feel of your tummy.
If we don't fix it quickly, this can be life-threatening.
Emergency Registrar Dr. James Williams is all set to go after an energetic start to the day.
Bit of a hot ride in, but otherwise, been a good morning. Walked the dog, had some lunch, and here I am ready for the shift.
Dr. James arrived from the UK 7 years ago and is loving the change in lifestyle.
I certainly have enjoyed my time in Australia. I have had a chance to travel around other cities and the countryside, so I'm not planning to rush back at any time soon.
Corridors are looking a bit full this afternoon, so we'll see what the shift has in store.
And it doesn't take long before an alarming case comes in.
I got a 20-year-old female. She's actually a cheerleader. She's been thrown up 3 metres and has landed on her head. She's complained of pressure in her head. 7 out of 10 for pain in the neck.
Thank you, Mum. I want to leave.
20-year-old T was practicing for the upcoming National Cheerleading Championships when a routine catch went horribly wrong.
Just get you onto our bed and we'll go from there, okay? We're going to grab a story from the paramedics.
T's been thrown up approximately 3 metres in the air. She's actually been dropped at the point when she should have been caught.
Cheerleading is one of the riskiest sports for female athletes, with a skyrocketing injury rate.
The way T has fallen sounds like she was thrown up in the air and the throw has actually gone wrong.
She's landed on her head. She's sustained C-spine tenderness and pain.
Take a deep breath, Tony.
I'm worried mainly about injuries to her head, which could include things like a skull fracture with potential bleeding on the brain. And with the neck pain she's experiencing, I'm concerned that she may have an injury to the bones of her neck and potentially even her spinal cord.
Hi, T. I'm James, one of the doctors. We're just going to look after you, okay?
Yeah.
And you've had a decent fall. You in any pain anywhere at the moment?
Just pressure on my head.
Okay. Whereabouts is that pressure?
Temples going through to the back of my head.
Okay, is that on both sides?
Yeah.
Yeah.
The pressure in T's head does ring alarm bells. Pressure could certainly mean an injury such as a skull fracture or a bleed in that area.
Squeeze my hand.
With the potential for serious injury,
Yeah.
trauma doctor Sue Lee has been called in.
Gonna have a feel of your on your face. Okay.
My face was really tingly before.
Was it okay?
Yeah.
Is it tender when I press down on your
no.
face? Okay. It's up here.
Yeah, there.
On the right.
On both sides.
On both
It's like
sides?
even pain.
Okay. So we'll have a look at her back.
Yeah. Well, why don't we do that now?
With T's neck taking the full impact of the fall, the team is anxious to check her spine.
So we're just seeing if there's any injuries that we need to find out about. But what we'll do is we'll roll you onto your side shortly so you can just feel down your back. If there's any areas that are particularly sore, just let us know. I'll be sort of holding and supporting your head. Is that all right? You let us do all the work, okay?
Yeah.
Okay, so on 3, 1, 2, 3.
Oh, it just really hurts on the right side.
Let me have a
Nice
feel.
deep breaths. Just let us know if the bony bits are sore.
Oh.
That's sore?
Yeah.
T's severe neck pain puts Dr. James on high alert.
So was that
Was
C-spine
it really
tenderness
pain? Yeah,
too?
the C-spine tenderness.
Sore?
Oh.
If she's damaged her spinal cord, that could be long-term neurological damage and potentially even paralysis.
1, 2, 3. Well done.
Baz, how are you going with the EFAST?
Dr. Faz is urgently scanning 79-year-old Anthony to find out if he has a life-threatening lung collapse or a bleed in his chest. The lifelong tradie is struggling to breathe and is in terrible pain after falling backwards off a ladder, landing heavily on a fire hydrant.
What were you doing up the ladder?
Trying to cut a tree.
So far, no pneumothorax and no obvious hemothorax on the left.
Okay, all right, great.
I wouldn't be surprised if if there's a small pneumothorax or small hemothorax, but certainly nothing obvious.
Yeah. So we'll get the x-rays and then we'll regroup.
Sounds good.
A chest x-ray can show us a large pneumothorax, a lung puncture.
Stay nice and still.
And give us some information about a hemothorax, which is blood around the lung, and if there are any fractures of the ribs. It's got some sort of lung contusion. Yeah. Okay, all right.
There's at least 2 rib fractures there.
Yeah.
Dr. Faz can now give Anthony one reason why he's in so much pain.
Anthony, so far, it looks like you've clearly got at least 2 broken ribs on your left. So we'll get... In a second, we're going to roll you towards me, and then someone's going to have a feel of your back and ask you if it's sore, just to see whereabouts you've got most pain.
1, 2, 3.
You're okay? Is that in the chest? Oh yeah, there's lots of bruising there. Is there any pain here?
Anthony has a lot of pain in his upper back, so I think it just increases our concern that he's got significant broken bones in the back of his ribs.
What about here? Keep telling me, yes or no?
Or a spine fracture. If you've fallen onto your back from a height, it's very common to fracture your back.
1, 2, 3.
Well done, mate. We'll give you some more pain relief. Don't move. Stay still, mate.
We need to be worried about a spinal injury as well. We should just be really careful to maintain spinal precautions for him.
Anthony's wife, Gail, has finally arrived to be with her husband of 57 years.
So you've done it last time.
Hi, Gail. I'm Beck. Were you there this morning?
I knew he was getting up the ladder.
Yeah.
And I knew that he had the whippersnipper with the chainsaw thing on the end. And I've been trying to stop him from doing things like that, but he just doesn't listen to anything. And he was told by the doctor not to get up on the ladder.
Okay.
Because if he has a major fall, it could be fatal. He has had brain bleeds before.
Okay. Anthony's actually had a couple of falls off ladders and has been told that he really shouldn't be climbing up ladders anymore.
Take him to CT shortly, okay?
This is obviously devastating for Gail. It's devastating for Anthony.
How long do you think he'll take?
In the CT scanner, it'll be 10 minutes. He'll come right back into you, all right?
We'll scan his head to make sure that he hasn't sustained head injury. Anthony's got clear abnormalities on his chest x-ray, some broken ribs, and his lungs don't look entirely normal.
See you in a little bit, okay?
It's really critical that we get Anthony to the CT scanner as quickly as we can so that we can assess these injuries further.
Emergency Dr. Michael Dunn
And what we do is we go along the base of the skull, so horizontal down.
has come in before his shift to run a special training session.
I had a couple of cases back to back of really terrible, life-threatening nosebleeds. I'd heard one particular podcast on how to manage catastrophic nosebleeds and some tricks that you can do with a catheter, and it worked brilliantly. Where you pull till there's traction and you clamp it down so it can't go anywhere. Do you want to try?
Let's do it.
Dr. Michael's skill set is not just in demand at work.
I had a 3.5-year-old and a 1-year-old, so whenever they have anything, a little scratch or, hurt a finger, wait for daddy. So I usually have to come home and tend to my patient at home.
Thank you very much.
Thank you, everyone.
But Dr. Michael won't be heading home anytime soon.
Roma, when receiving, go ahead.
His first patient is on the way.
Hey RMH, we're coming in with an air ambulance transfer for a 70-year-old male who's been involved in an MVA this morning.
No, thanks.
So what was the story again? It was a
70 rollover, degloved up. Degloved. They've come by HEMS and then road car to us.
Yeah.
Paramedics arrive with Gordon, who was on his way to a job for his landscaping business when the terrible accident happened.
This gentleman's been in this rollover car accident, but has a pretty significant injury to his arm. Probably described as like a mangled limb.
How are you? D. Loving. Hello. I'm Michael, one of the doctors. I'll be looking after you, okay?
The concern with that is whenever we have somebody with an injury to that extent is can we potentially save the arm?
We're gonna get you across to our bed. How's your pain?
Not too bad.
Good. Now, you just let us do all the moving, all right? 1, 2, 3. I'll get the story off these guys, okay?
Yep.
Come on.
Gordon was T-boned by another car travelling at approximately 60 k's an hour.
Now, Gordon, I'm going to go to talk to someone of you right now, okay?
Yeah.
His vehicle was rolled 1 to 2 times.
So his arm out the window, was it?
I think so, yeah. He does have some numbness on all of the digits on that hand.
The worry with him not being able to feel his fingers does tell us that there is some pretty significant injury there. If you have cut off blood supply to the hand and fingers, the nerves that control the area will essentially die off. And if that's not restored quickly, he might lose the hand itself.
He's working still overtime.
Working.
What do you do?
Being state civil contractor.
I'll go back down this president.
We'll get the portable X-ray and pelvis, and then we can have a look at this. Okay.
Who's at home with you?
The granddaughter.
Granddaughter. Lovely.
Gordon lives 2 hours from the hospital. His family is waiting at home for news.
How's your pain right now?
About 7 or 8.
In the arm, predominantly, is it?
Just below the elbow.
Just below the elbow, okay.
Gordon's injuries are exceptionally painful. He's got all this exposed raw tissue that's going to be extremely sore to touch.
We'll give you some painkillers before we start doing anything with it, okay?
But then there's the nerves, the blood vessels, and most likely the bones as well underlying it. We know pretty quickly that pain's going to ramp up.
Before Dr. Michael and the team can even examine Gordon's arm, they need to make sure he won't suffer.
How's your pain going, darling? Yeah, you want to get more pain of those?
I'll have to get some fentanyl now. 25 mics, be great. We got a couple of X-rays. Have a look at your arm.
With an enormous amount of pain medication on board, the team can begin to look at Gordon's shocking injury.
Another 25 with fentanyl going in.
From what I've been told from the paramedics, I'm expecting his hand to be a complete mess. This is going to be probably one of the worst hand injuries we're going to see.
One, two, three. Well, do you need some more pain relief?
Well, I don't know.
That's all right. You're a bit sore, so we might give you a little bit more, okay?
Dr. James and the team are worried that 20-year-old cheerleader T could have life-changing injuries after she was flung 3 meters into the air and landed head first during training.
We'll check your head and we'll check your neck, and that will be with the CT scan.
Before T can go to the CT scanner, Dr. James needs to make sure she doesn't have any internal injuries.
I'd like to do just a quick ultrasound. Good, that looks fine. I'm just going to have a look at your tummy. You got a competition coming up then?
Yeah, Saturday.
Oh, Saturday. Well, let's hope we can sort you out by then.
Yeah, fingers crossed.
Is there anyone you need us to let know you're here?
Have you called my sister yet?
T's sister Anne is waiting anxiously to see her younger sibling. She knows how much cheerleading means to her.
She has been passionate about cheerleading since high school. I guess all the cheerleaders do get an injury of some sort. I worry all the time.
The pressure on my head's getting worse.
Without warning, T's condition deteriorates.
Did it just come on suddenly, or?
Yeah, just, I don't know where.
I'm just going to feel behind the ear.
Oh.
Is that a bit sore there?
A little bit.
Okay. Do you think that's where you landed?
I don't think so.
That's okay. Can I feel this side just for comparison?
Yeah.
T has now become very distressed with worsening pressure and pain in her head, which worries me because is there a bleed?
Oh.
It's a bit sore, hey?
Uh-huh.
Or has a fracture started to cause more pain?
But it's just like this constant pressure, and it's like, it was a 7 initially. It's an 8 now.
Okay.
Oh.
The fact that the pain is getting worse means that we need to manage that pain and get her to the scanner quickly.
We got a couple of X-rays.
Dr. Michael and the team are about to X-ray 70-year-old landscaper Gordon's right arm that was ripped open in a rollover accident.
The chest, pelvis, and right forearm up yours.
You can show your honor what's on the board. Even if you got a pillow or something under there to hold the board up.
Given the extent of the soft tissue injury, I'm expecting there to be quite a few fractures to his hand, and that would be quite challenging to correct.
That looks okay.
The x-ray for his chest and pelvis reassuringly is fine.
Okay, guys, last x-ray of the arm, and then we'll have a look at what we're dealing with. Oh,
Yeah.
that's terrible.
Very big.
Oh my God. It's all just smashed. With a bag of bones.
The x-rays of Gordon's hand are devastating.
Oh, he's done everything. Yeah, he's done the whole, this whole thing's completely clear out, isn't it? It's pretty bad.
Gordon's hand structure is completely gone. From the x-ray alone, we know that the injuries are going to be severe. We know that before we even take down the dressings, this is going to be a disaster.
Fearing they may not be able to save his hand, Dr. Michael asks the question that could have life-changing consequences for Gordon.
Gordon, are you right-handed? Yeah.
Gordon's actually injured his dominant hand. Trying to use your left after using your right for 70 years is a real challenge. And for the work that he does, this is going to be devastating for him. It's going to alter his life moving forward.
He's completely degloved, isn't he? Okay.
With a clearer picture of how critically damaged Gordon's hand is,
Hi there, could I get the plastics reg, please?
Dr. Michael immediately calls the surgeons on standby.
We're going to get the dressings down shortly. I was wondering if you were free to come down and have a look. Thanks.
I've just called the plastic surgeons. They're going to need to see Gordon's hand as soon as possible.
Thanks for coming down.
Gordon, I will get the plastic surgery.
Plastic surgery consultant Dr. Jeffrey Lee tries to get more information about the crash.
Did you remember exactly what happened? Yeah, in your arm was out.
Well, it wasn't out. It's just the window was down. And when I got hit on the left-hand side, I went my right hand.
Someone else screwed did your car roll? Yeah. Okay. You got out yourself. Yeah, yourself. Yeah. We're going to take the dressings down and have a look now, okay?
We've just given some fentanyl there.
Gordon, I'm just going to give you some medication for the pain, okay?
Whenever we're about to take down a dressing, we're hoping for the best and hoping that it's not as bad as what we think it might be.
The team know that what they are about to see will be confronting.
Things get bad, we can stop and we can...
Back to tomorrow.
Yeah, exactly.
I'm a little bit shocked. It easily is the worst hand injury I've ever seen. The outlook is not going to be good.
Almost there, doing great, doing great.
I have very serious concerns that Gordon's going to lose the hand.
Retired tradie Anthony is being scanned for possible head, chest and spinal injuries after falling off a ladder when he was pruning his lemon tree.
Done well, buddy. He's an old plasterer, you know. You're not going to take a ladder away from plasterer. He's going to have a hard conversation with the missus when he gets home.
I reckon.
There's some air, and there's some air right at the top.
Yeah. We can't see any spinal fractures, so that's a real relief.
Yeah. There's no subcut emphysema, is there? Like I could...
But there are 4 rib fractures, and underneath that left lung, there's also quite a bit of bruising. And he's got a small pneumothorax, which is just a little bit of air pocket in the lung.
Anthony. Hey, it's Beck, the doctor. The first fantastic news is that there's no broken bones in your neck and I can get that collar off you. Much better, isn't it? So I've had a look at your scans. Your main worry is the left side of this chest, which I know that's really sore. You've got broken ribs in ribs 6, 7, 8 and 9. So you've done a good job. You'll be very, very, very sore over the coming days. One of the things that can happen when you've got lots of broken ribs is that you're unable to take a deep breath.
Rib fractures are incredibly painful. If he's not able to breathe and move his lungs properly, that allows infection to brew, and he's at significant risk of developing pneumonia. So the most important thing for Anthony at the moment is making sure that we give him really adequate pain relief by actually doing a local anaesthetic block of that left rib cage.
Having performed many nerve blocks, Dr. Faz steps in to do the procedure.
Are you happy for me to go ahead and do it?
Oh, happy as Larry, mate.
The nerve block is quite a simple procedure.
I will aim to go in from here.
We put the anaesthetic between the chest's muscles and it supplies the nerves that target the ribs. It just numbs those nerves so the pain from the broken ribs is reduced a lot.
A little bit of pressure now, Anthony, okay? Can you see the needle tip?
Yeah, yeah, beautiful.
So now aspirate.
Aspirate.
All done.
Anthony's feeling a little bit more comfortable, but this is going to be weeks of recovery and then probably another few months before he feels back to himself again.
I heard your family have hidden the ladders from you.
Yeah.
So where did you get the ladder this morning?
Put letters underneath the house, underneath our work shed.
I think you're banned now. Yeah, yeah.
Anthony is heading to ICU, where his breathing will be closely monitored until he's stable enough to go to a ward.
Did you hear? It turns out he's got a stash of ladders hidden under the house that his family don't know about.
Jesus, no, I didn't know. Secret ladders.
Secret ladders.
Good job today.
Yeah, thank you.
The fracture's getting worse in my head again.
Okay.
20-year-old T is in acute pain after she was thrown 3 metres into the air and landed on her head while training for the National Cheerleading Championships.
So we'll see if we can get on top of your pain, okay?
Nothing seemed to help with the pressure.
Dr. James urgently wants to get T to the scanner to check for a possible brain bleed as well as skull and spinal fractures.
Well done. All right, we're just giving you some more pain relief, okay? So wait for that to kick in.
But right now, she's too distressed to be moved.
Try and take some deep breaths to relax as well.
CT pretty much ready for her.
If T does have injuries to her spinal cord, the consequences of this could be really significant for someone as active as T.
Oh, go.
I'm gonna get her out.
And it may even prevent her from doing what she loves in the future. So the scans have come through.
Dr. James can now finally see how much damage T's fall has done.
This is the back of T's head where the pain is most severe, but currently it looks normal with no signs of bleeding, no obvious skull fracture. Just coming into view on the screen now is the bones that protect her spinal cord in her neck, and can't see any obvious fractures, which is reassuring. But she's still got pain there, so she's not completely out of the woods.
Although the CT scans have cleared T of any broken bones, Dr. James is still worried about why her neck is so painful.
T could still have damaged her spinal cord, and the CT may not pick that up. Hey, T. Given that she's got ongoing pain, the next test will be an MRI scan, which will have a closer look at the spinal cord and the nerves in that area.
If I get told that I can't cheer anymore, that would be a really bad thing for me, I guess. Like, I don't think I'll be able to handle that. So hopefully I get cleared and I'll be able to continue cheering.
T will need to be admitted to hospital under the care of the trauma team, who will get the MRI done as soon as they can.
T will head to the ward while she waits to find out if she has any serious damage to her spine and if she'll be able to cheer again.
Yeah, I've got the joint inside the thumb.
In Trauma Bay 1, Dr. Michael and the team are taking their first look at 70-year-old Gordon's extremely mangled arm.
How's your pain going? Do you want to be more pain, please?
Almost there, doing great, doing great.
For Gordon, he's clearly going through quite a lot. Sometimes it's important to have someone there to support him. being there, holding his hand, talking him through it. You hope that you can provide some comfort.
Sorry, just want to have a look at your fingertips to make sure they are alive.
I think the smallest gestures tend to make the biggest impact.
Right.
Can really make the difference between feeling like you're completely isolated during this event or feeling like there's someone there to help you.
So all your fingers seem to be alive, which is, good.
There does appear to be some reasonable blood supply to the fingers. At the same time, having seen enough injuries in my career, I'm concerned that this is one that's going to be very difficult to salvage.
Yeah.
You saw?
Managing Gordon's agonising pain throughout is emergency nurse Kira Mayron's top priority.
I know in the pain.
Gordon appears really stoic, even though he's in lots of pain, and he's doing the best that he can do to get through this day.
Are you happy for some more fentanyl?
Yeah, should be fine. Yeah.
That's where I come in to make sure that he's nice and comfortable and we can support him through this. It is important that we keep up a level of analgesia so it's not too painful for him.
Another 25 of fentanyl going in.
But there's also a very fine line that if we give too much, then we can depress his breathing.
Nearly done there. Put a palm on there soon and get a scan.
With Gordon's wound cleaned and rewrapped, the team need to get him to the CT scanner before he can be taken to surgery.
I think CT is free. I'll call him now.
Gordon, take some big deep breaths through your nose, my dear.
But before they can leave, there's an alarm. Gordon's breathing has slowed to a dangerous level.
Put a non-rebreather on, because I think he's a mouth breather.
Whenever we give strong pain medication to people, we expect their breathing to slow down. The only issue with the breathing is if he stops breathing altogether.
Gordon, take some big deep breaths.
Big breaths, Gordon. Nice big breaths for me, okay? Big breath in and out.
Dr. Michael and the team are getting 70-year-old Gordon's breathing back to normal after it's slowed to a dangerous level.
Your nose again, so I can keep the closer eye on the breathing.
I'll keep him breathing. Do you want to grab an ETA? How are you feeling?
Yeah, bad.
We're going to get a CT scan out, head to pelvis, now a CT scan of your arm as well, okay? Big breath for me, come on.
Gordon's next stop is to CT, and that's really to firstly have a look to make sure he's no other injuries from the car crash apart from the hand.
Hey, it's Michael. Yeah, good to go.
We want to make sure if he's going to the operating theatre and he's put to sleep that nothing else is going to cause any complications. It's going to be critical for the plastic surgeons to know what their approach to this is.
Nice big breaths for me, okay? Big breath in and out. Across on 3, 1, 2, 3. Now, I know you're sleepy, but I want you to try and stay awake for me, okay? And take big breaths for me, all right?
As Gordon goes through the scanner, the team keep a close eye on his breathing from the control room.
Big breaths, Gordon. Big breaths in and out. Come on. Come on.
Dr. Michael watches the detailed images as the scans are completed and can now prepare Gordon for what's ahead.
It's going to be a few operations on the hand.
Do you?
Yeah. But we'll see what
I'll be here for a while.
Yeah, you will be. Yeah. If you can't work for a while, how will that impact you financially?
Oh, well, yeah, it will. But, hopefully I end up with everything still there. When do you reckon I'll be going in to the operation?
The plan is today.
Gordon's going to be going through multiple surgeries on this hand to try and piece it back together as best they can.
If your pain gets worse, let us know, okay?
Yeah.
There's a very real possibility that the time may come where they may decide that the best thing for Gordon is to actually amputate.
Okay.
I'll come back and let you know, okay?
Yeah.
All right, come on. No worries.
I think Gordon's a very stoic guy, and he's, it's going to be a lot of emotions he's feeling at the moment. This is, a devastating injury, and it's going to be a very tough journey for him.
Gordon will now head to a ward where he'll be prepped for surgery.
I'll see you tomorrow. I'm
Is he on the ward? Oh.
This is going to have a pretty profound impact on him.
Emergency Dr. Jonathan Papson has a hectic shift ahead of him, triaging patients coming into the ED.
Can I say, Dr. Triage is not a quiet day. The ambulance corridor is often full of people queuing to get into the department, and we try and see patients who we can make a difference on easily and quickly right at the front door.
Waiting to be seen is 35-year-old meteorologist and punk rock fan Tim, who's been picked up by paramedics at a music festival.
Just tell us what happened.
I was in the mosh pit just holding a dude up in the wheelchair, and he... above hand up, and just holding me and 4 guys holding the guy up in the wheelchair, and it just, my shoulder was getting.
So he's been in the mosh pit with his mates and he's held up the guy in the wheelchair and he's jumping around and dancing and jerking his arm and his shoulders popped out.
So the thing is, when your shoulder's up like that, that's the vulnerable position where the thing dislocates. So if it feels like it probably is.
And the question is your shoulder broken? Is it still dislocated? It seems a bit too sore for just a sprain, but we'll see.
Can you walk?
Yeah.
Wait, come on, let's do it. Yeah. Is that the way you normally wear your hair?
That's how I look normally, yeah.
If only I had hair.
What can I say? It's a good looking mohawk.
I think it's...
Not really my thing. Didn't have a mohawk, sorry. I think I just always look the same.
How about I do this? Sorry.
Yeah, no, that's so good. It's probably one I would not have worked out how to do.
Why don't you lay back, put your feet up. I'll get some Panadol.
Dislocating his shoulder is not a new experience for Tim.
I wish I could say it's the first time it's happened. It's that unmistakable feeling. I got a mate just to grab it and pull it and see if it goes back in. Fucking hurt. I'm an idiot, basically.
Have that.
Thanks.
Wash it down with this. And so what did your friend do?
I got him to pull it behind me and down and out. So
like this?
Backwards, out, and back in.
Oh, yeah.
And
what
it
happened after
felt
that?
like it went back in.
Yeah. You felt a clunk or something? Or
Yeah, I felt that kind of snapping feeling that you
snapping.
get.
Right, okay. Yeah.
But then it didn't go back to feeling how it should. I've still got tingling in the fingers.
Did you have tingling in the fingers immediately after it came out?
It was after we put it back in, the tingling we here.
His friend may have done it absolutely perfectly, but normally when a shoulder goes back in, it doesn't hurt much anymore. So I am a bit concerned, has the process of relocation hurt it some more?
So if you take a seat there...
Needing to find out exactly what's going on with Tim's shoulder,
I'll get you an X-ray and then we'll have a look.
Dr. Jonathan quickly organises scans.
You ready for next day?
Yeah.
Come through and see. So which shoulder are we looking at?
Ending up an emergency with a painful injury is the last thing Tim expected when he headed out to the festival.
Worst case scenario here is that his shoulder's still dislocated, he has a fracture as well, and he's got nerve damage. But look, he was in the mosh pit. Anything's possible.
I want to get this T-shirt off.
Dr. Jonathan's waiting for the X-ray results for 35-year-old punk rock fan Tim, who dislocated his shoulder in a mosh pit while helping a man in a wheelchair to crowd surf.
We don't want the shoulder to go up, right? We don't want to... Oh, there you go.
The worry is Tim may have seriously damaged his shoulder when he got his mate to pull it back into position.
Oh, no, it's in. Yeah, it looks in.
It's in, yeah, that's what I maintain.
Yeah, no, it's in.
I'm delighted that the shoulder's back in. But if the shoulder's in place and he's still sore, does that mean there's something else that's happened? Is he up for something worse than a shoulder dislocation?
Is that sore?
It's around the back and down through there. But...
Yeah. Are you numb here?
No.
No? The numb area
the
was...
numbness is more in the fingers.
So the thumb is numb or not?
It's not completely numb, but there's a tingling in there. Like compared to that hand, it's
and this
very...
finger, is that tingly?
Yeah.
And so they're all tingly, yeah.
So it's a little bit unusual that Tim's got numbness in his fingers. And we sometimes see that with an injury called a neuropraxia, where you stretch the nerves in the neck or in the armpit.
Usually when the shoulder's dislocated, you go numb here, right? Yeah. But sometimes a yank on the arm can actually make the nerves that come out here stretched and give you tingling in the fingers.
Usually that sort of injury comes good, but in some people it's permanent.
Here's Tim's X-rays.
Dr. Jonathan can at last see what happened to Tim's shoulder in the mosh pit.
It looks all right. So this is his shoulder. That's lining up with this bit. Has he got a fracture as a result of it falling out and getting put back in? Doesn't seem to. He's got a sore shoulder but the bones look okay. So the shoulder's not dislocated. You've got a bit of a, we call it a neuropraxia from a stretch. That usually gets better.
Given Tim's history of dislocations, Dr. Jonathan has an important piece of advice.
If it happens again, what we normally do, if you lay down and they just lift your arm up, right?
It's so much simpler.
Right? That'll often just go back in. Then they can just put a little twist in the top and it will go in. And if that doesn't work, then you come to hospital and we do it for you. Stay in this thing for a week, all right? Get it all settled down.
Yep.
All right, you can ice it as well. Maybe just take it easy. Maybe don't go in the mosh pit.
But Tim's not giving up on seeing his favourite band just yet.
I reckon I'll be all right. If I can get back in, I can go see Frenzel. Not in the mosh pit, but I can stand on the edge.
Tim wouldn't be the first person to have something fixed by us and then go straight back to the activity which caused the problem. Not a good idea.
All good to go.
Not even with a sling on. Not to a mosh pit. Come on.
1, 2, 3.
70-year-old Gordon suffered a devastating arm injury
He's completely degloved, isn't he?
when his car was T-boned and rolled several times on his way to work.
Oh my gosh. It's all just smashed bag of bones.
It easily is the worst hand injury I've ever seen.
Gordon, are you right-handed?
Yeah.
Worried Gordon could be facing an amputation,
We'll do the dressings down shortly. I was wondering if you were free to come down and have a look.
Dr. Michael called in the plastic surgery team to see if any part of his hand could be salvaged.
If you can't work, how will that impact you financially?
It will, but hopefully I end up with everything still there.
Despite multiple operations, Gordon's smashed hand could not be saved. Gordon's now back running his landscaping business and undergoing intensive rehab. Distraught 20-year-old cheerleader T had severe head and neck pain
That's all?
Yeah.
after she was thrown 3 metres into the air and crash-landed headfirst while training for the National Cheerleading Championships.
The pressure on my head's getting worse.
We'll see if we can get on top of your pain, okay?
Even though CT scans ruled out skull and spinal fractures, Dr. James was still worried T could have damaged her spinal cord and ordered further scans.
If I get told that I can't cheer, I don't think I'll be able to handle that.
2 days later,
All right. All the best.
Okay, thank you.
T's back on her feet after she was given the all clear.
There's probably a lot of swelling, but nothing like life-threatening. I'm waiting on confirmation if I can actually compete on Saturday.
With a couple more days of rest, T recovered just in time for the National Cheerleading Championships.
I was in the mosh pit just holding a dude up in the wheelchair. My shoulder was gave.
Punk rock fanatic Tim ended up with a nasty dislocated shoulder when he helped a fellow music fan in a wheelchair to crowd surf.
Oh no, it's him. Yeah, it looks him.
To Dr. Jonathan's surprise, Tim's mate put his shoulder back into place while still in the mosh pit.
And this finger, is that tingling? Yep. So they're all tingling.
But it left him with some worrying nerve damage.
Maybe just take it easy. Maybe don't go in the mosh pit.
4 weeks later, all sensation has returned to Tim's hand and his shoulder is back to normal. 79-year-old retired plasterer Anthony came into the ED struggling to breathe and in a lot of pain.
Have a deep breath.
After he fell off a ladder while pruning his lemon tree.
You've got broken ribs, 6, 7, 8 and 9, so you've done a good job.
CT scans revealed Anthony also had a punctured lung and he was taken to ICU. After 4 weeks in hospital and months of rehab,
How's your lunch going?
Anthony is back on deck and reluctantly staying away from ladders.
What have you got?
I've got an old album. I think my days of going up and down ladders are finished. I watch pretty carefully.
What's in it?
Some young people.
Anthony is grateful for the support of Gail,
There's Nick.
his wife of 57 years, as he continues to recuperate.
Gail used to come and see me every day. I was in ICU for a week. I wasn't in great shape, but I'm getting better.
We look pretty good, you know.
Changed a bit.
Well, that's what time does too.
Anthony and Gail are looking forward to creating more memories together.
I'd like to do a bit more travelling, just to go for a little trip, even around Victoria or Australia. Well, Melbourne did very well. They kept me alive.